Good morning, everyone. Thank you for being here in person or on the phone. We are not going to take a lot of your time. We want to update you with the newest information about COVID-19, the coronavirus, and we want to answer your questions. First of all, I want to thank the Educational Service Center, Dan, Matt, Susie, and the team. They've been here since early this morning. They were working on this yesterday as well. It's a beautiful facility, and it's larger than anything we have in the health district, and we wanted you to be able to spread out because we really can't hold a meeting and turn around and break all the rules that we're asking you to consider from this point and moving forward. So thanks to Dan and Matt and Susie. It's great that they're giving up their Saturday. Thanks to my team and all of you who are giving up part of your Saturday as well. They don't get to go home after this though, unfortunately. So this is an unprecedented time in our history. We don't have a case of the virus in Clark County that we know of at this time, but I'm standing before you today telling you that it's only a matter of time before we do. There is community spread. The cases you're seeing right now, the prediction is that the cases are going to double in Ohio every 5 to 7 days. We're not going to be spared. So all of the things that we're doing is to stop the spread of the disease, to slow the spread of the disease. We know we're not going to be able to stop it. We're not going to be able to totally contain it. We're going to do everything we can to continue to contain it. But we are going to very quickly move into the mitigation phase, which is just continuing to try to slow it down. So I think everybody knows what COVID-19 is, unless you've been in a hole or a cave and you haven't watched the news. I'd be cautious watching the news because they're sensationalizing it. I would move back to sources such as the Center for Disease Control and Prevention website. Honestly, that's where we're getting almost all of our information. Some of it is filtering down through the Ohio Department of Health. And I would tell you, this is my opinion, so I'm sharing opinion, not fact. The governor and the director of health have done an outstanding job so far. I've never seen, I've been around state and local government for over 30 years now, and I've never seen the state government move as quickly as they have in this time of emergency. So in December, the Chinese knew about this. It's gotten out of control. We have over 2,000 cases in the United States now. And once again, that number, we think that number every 5 to 7 days is probably going to double. In your packets this morning and in the information that we sent out to your email addresses online, there's a curve in there, and that's the pandemic curve. So there's the really tall curve, which is what happened in China. It accelerated very rapidly. It's shared about every one person that gets it, gives it to 2.3 additional people, and you've got this exponential increase in the disease. And it's a pretty steep curve. And then you see it gets to the top, and now where China is, they're on the way down in that curve. You also heard probably that China built multiple hospitals near Wuhan City to house the people and do that. That's going to be really tough for us with the standards that we have in the United States to be able to build hospitals that rapidly if our cases go up. So the whole intention of the school closures and limiting mass gatherings and limiting travel, all of those things that are drastically hurting our economy, all of those things are meant to push the top of that curve down. Imagine you have a balloon that's this size, and you put your hands on it and you push down, what happens to it? The volume of the balloon does not change, does it? It just gets flatter, it moves out. And so we're trying to go from the red curve, and actually the Chinese curve was actually worse than that, much taller. We're trying to go to the blue curve. And the reason we're doing that is two things. we're trying to keep the healthcare system from being overwhelmed. Right now, every hospital in the Miami Valley is full. They're full of influenza cases. This has been probably going to set a record for the number of influenza hospitalizations in the area. If it's not a record, it's going to be near it. And so we're trying to flatten the curve out. We're trying to push these cases over a longer period of time. A, so we can get out of flu season, so it starts to warm up and we get that normal trend away from it. And B, so that there's enough personal protective equipment. It's filtering in a little bit at a time. Nobody's being allowed to stockpile it now because there's no place to get it. So even the distributors are piecemealing it out a little bit at a time so that no one is hoarding it. Well, that's giving us enough PPE to do what we have to do, but not if we're in that steep curve, but only if we push this over time. And so when we push that curve down, we increase the time that we have to deal with this, but we also don't overwhelm our medical system so that people that do get sick and do have to be hospitalized, which would be about 20% of the people that get the illness based on the statistics, 80% of the people will have mild to medium symptoms and will not need medical treatment. But it's that 20%, especially those that have chronic conditions and have other issues with their lungs or emphysema, or COPD, heart disease, diabetes. Those folks are more at risk and they're more likely to need medical treatment. So we still expect to see cases. The Ohio Department of Health is estimating that we'll still see at least 100,000 cases in Ohio. You can't do the math because when we're using statistics, it doesn't go to that local level. But if you did do that, that's going to be 860 some people that get sick in Clark County alone. Could be more, could be less. I would tell you, if you've been keeping up with our health assessments over the last couple of years, our county is not the healthiest county in Ohio. And so we have a lot more folks with chronic conditions. We have a lot more people who have smoked over the years and therefore are at a higher risk for complications of the disease. That means we have to do an even better job in Clark County listening and doing the things we need to do, the personal protection and the meetings and gatherings. We need to do a better job with that because otherwise we're at a greater risk in our county. The symptoms of this are pretty simple. Fever, usually a dry cough, and lower respiratory, potentially difficult breathing. We see that with, those are some of the symptoms that we see, in fact, with influenza. So it's hard to differentiate the two. We've had limited tests available. There are tests available. So I got a text last night. When are we getting test kits in Clark County? Well, tests have been available in Clark County for a couple of weeks, but you have to meet a certain criteria to get the test. And then last Friday, so a week and a day ago, the Ohio Department of Health laboratory came online, and the some commercial labs have come online last Friday and then during the week this week. So it requires a doctor's order to get a test, and those tests at this point, things are moving very rapidly. Some of the stuff I tell you today may be, well, by this afternoon, may be invalid because new things are coming out all the time. But the doctor has to order it, and the doctor needs to talk with Anna Jean or one of her staff in our communicable disease group and epidemiology to make sure that they fit on the grid in the right place to say they should get a test. Tests are still limited, but as more reagent becomes available, more labs are going to be able to do it. More labs are coming online. The labs who are doing it are going to get more reagent, and we'll be able to do more and more testing. It's not going to be, we're just not going to test everybody because, oh, I want to test, I want to test, I want to test. No, you have to have the symptoms And so far, you've had to have symptoms plus travel, symptoms plus contact with a known traveler or a known case of COVID-19. Now there will be more and more cases, so there'll be more and more contacts, and there's a whole grid that our folks use when looking at contacts. So when the first thing we do when we have somebody who's being tested, we go through and we figure out who all the people are that they've been in contact with, and then we look at the grid and we figure out whether they're high, medium, or low risk, whether they have symptoms, whether they don't have symptoms. It's a pretty complicated chart, and then we decide, are they 14 days home quarantine? Do they need tested? Are they free to walk around and do whatever they want because there's no restrictions on movement? It's all based on an algorithm that our folks are using every day. Questions?
So how does that work? You know, I or another citizen feels sick. They go to their doctor. Now, the doctor can order the test. Now, do they take blood work there and send it to the test facility, or does the citizen or myself have to go to the test facility?
Okay.
Where is that test facility?
So good questions. Let's repeat the questions for those callers online so that they could hear. I believe he's asking, so if somebody has symptoms, if a citizen has symptoms, what do they do? Where do they go? Does the doctor test? How do they get tested? So I'll tell you what, I'll try to answer the question, and then when I don't hit all the points, you say, yeah, but you missed this one, and I'll come back to it, okay? So the best thing to do would be, if you are not having difficulty breathing, meaning it's an emergency, would be to call your physician's office and tell them the symptoms that you're having. They will at that point begin to use a decision tree to decide what to do next. They're obviously going to be looking for the fever and the cough and any shortness of breath. If they order a test, the test is not blood work, it is a
nasopharyngeal swab.
Say it louder.
It's a nasopharyngeal swab.
Okay.
So it's from my experience, it's a 4-inch long wood stick with a cotton swab on the end of it, and they stick it through your nose, into your nose, to the back of your throat. It's not pleasant. It's not pleasant. Might even make you gag, but what they're doing is they're getting back in there to get some of that mucus that's on the back of your throat, in your nasopharynx, and then they're going to put it in a tube, but it has to be done by a medical professional who is properly. So what happens when somebody puts a stick in the back of your nose or throat? You're going to cough and gag, right? And so you may actually cause some respiratory particles to come out. So they need to have a face shield, they need to have a mask, they need to have a gown on and gloves to protect themselves so that they don't get this virus. So most doctors' offices are not doing the testing in-house because they don't have all the proper protective equipment. They will send you to a location,
And where are those locations within Clark County?
So right now, the only people that are able to do the test would be at the emergency department, but that is being
At Springfield Regional?
Springfield Regional. I think they can also do it at the Enon, and I think they can also do it in Urbana. But we don't want people to go there for a test because you can't walk in and just get a test. You've got to go through your medical provider. It has to be ordered. And I would tell you, we're working with the hospital on a daily basis about coming up with another location other than the emergency department to do those tests, because we have sick people at the emergency department and people with broken bones and all kinds of other places. So we're not running around telling the general public this is where you go to get a test, because it's not where you go to get a test. You contact your doctor's office, and that's where you want to start the process. Now, in the next couple of days, based on what we heard yesterday from Vice President Pence, there's a public-private partnership, and supposedly they're going to be doing tests in the parking lots of Walmarts and CVS's and Targets soon. We haven't seen anything written on that. We've heard exactly what you've heard. We're excited about that, but once again, there's going to have to be a medical provider who who says, just like getting a prescription medicine, you just don't go to the pharmacy and say, hey, I need some of these. You have to have a medical professional prescribe that for you. Anna Jean, you want to add to that?
Yeah, I just wanted to add that the test for COVID-19, it's not a rule out test. You don't go to the doctor just to rule out COVID-19. They have to do some more testing before, well, they should do some more testing before they decide to send out a COVID-19 test. So that's a flu test and a respiratory panel, maybe a chest x-ray.
So once again, we don't start with that test. We do those other tests first because most doctors' offices have a rapid flu test. It's still expensive. It's over $100 to get that, but that's one of the things that do. I don't even know what a respiratory panel costs. I'm sure that's not an inexpensive test. Done the same way though, right? It's a nasopharyngeal swab for both the respiratory panel and the, okay. So we're learning more about lab testing than we ever wanted to know. So that comes down to, your question also triggered something that I hadn't covered yet. How is the virus spread? The virus is not spread that we know of like SARS was. SARS was an airborne virus, and we actually saw it go through a ventilation system in a hotel to other people. We're not seeing that in the case of coronavirus. We're seeing it spread by respiratory droplets. We've all seen the picture or the video, the slow motion video or the picture of the sneeze, right? Where it's just, you see all these tiny little, like a mist of droplets coming out from someone. Those droplets either get on a surface that we touch, or most likely, I'm really close and I sneeze and you don't see it, but a little tiny particle, gross, gets into his nose or in his mouth, and then he's now infected by that virus. The other thing that can happen is I can cough into my hand, and then I can grab this handrail, as I should, to steady myself, because I'm getting old, going up these stairs, and then he's going to go down the stairs and touch the same thing, and then his eyes kind of itchy, because we start talking about eyes, and your eyes start watering, and then he wipes his eye, and he gets it in the mucous membrane of his eye, and he's got that. This virus, we don't know a lot about it, but what we think we know about it is that it is much more highly contagious than influenza. So it takes less of an interaction, less of an amount of the material, the droplet, to get into your eyes, nose, mouth, to give you the virus. So a lot of the question we're having is, well, why? Why all this stuff? There's not even anybody in Clark County that we know of that has COVID-19. Why are we overreacting? We're overreacting because the things that we've learned from Washington State, the things we've learned from Singapore, the things we've learned from China and Italy have told us that if we do these things, we can save lives. We can flatten that curve. We can protect our healthcare system. And so that when somebody does get pneumonia, that we have a chance of giving them the palliative care they need so that they can, in fact, recover. So the draconian measures that the government is now taking in Ohio and in some other states have disrupted all of our lives, have made all of our retirement plans kind of take a nosedive. It's all because we're trying to save lives. So Jenny, maybe you don't want to retire.
I already signed my papers.
Take them back. Take them back. Just make sure that they don't have coronavirus on them when you get them back. The new letter that came out yesterday, I don't know if you've seen it yet. I just saw it from the Attorney General's office. Is having us reconsider the Sunshine Act, the Open Meetings Law, And so I thought it was an Attorney General's opinion. It's not an Attorney General's opinion. It's a letter to local officials asking you to contact your legal counsel, but weighing the Sunshine Act, which the legislature passed, and we know from the Ohio Constitution that if the legislature passed it, that the executive branch can't just sort of change it, right? But, I'm sorry I'm reading this, but I want to get this right. So this is halfway down in the order. We've also sent this letter to all of the email addresses that we sent out as the invitation. So those of you that got the invitation from someone else, ask them for a copy of this, but I'm just going to read a short part of it. And I quote, "To summarize, the Ohio Department of Health, with ultimate authority over issues of isolation and quarantine, is currently forbidding mass gatherings and advising social distancing at all others. At the press conference, both Dr. Acton and Governor DeWine took their advice one step further. In the interest of stopping the spread of this highly contagious, highly communicable disease, both urged Ohioans to stay home and avoid unnecessary contact with one another. Thus, we are now presented with a situation in which a public body might not be able to comply with both the terms of the order from Director Acton and Governor DeWine and the Open Meetings Act. Stopping the business of government is not an option, but we must now reconcile the two. To do so, it is necessary to consider the applicability of OMA's in-person requirement in the context of Dr. Acton's order and the rapidly developing information about the spread of COVID-19. As we must always do when faced with the application of two different, and in this situation, somewhat competing statutes, we must give effect to both. That is, we must give effect to the OMA's in-person requirement while recognizing and complying with Dr. Acton's ultimate authority over matters of isolation to stop the spread of a highly infectious disease. The task is possible here. In this limited circumstance where the governor has declared a state of an emergency and the director of the Ohio Department of Health is limiting gatherings as so to stop the spread of COVID-19, but the business of government must continue, it is reasonable to read the OMA's in-person requirement as permitting a member of a public body to appear at a public meeting via teleconference. I pause at that moment from the reading to say they have always told us in-person means in-person. I started the presentation with you today saying this is unprecedented. We're going in a territory we've never been. And so I'm requesting that you consider talking with your legal counsels, for those of you that are required to have open meetings, to see if we in fact can do both by using the public meeting via teleconference. I continue reading. This interpretation gives effect to both Revised Code 121.22 and 3701.13. It is also consistent with United States Centers for Disease Control's recent guidance issued in response to the national COVID-19 epidemic to use video conferencing for meetings when possible. There's a link in the letter which takes you to the CDC guidance. Of course, if a member of the public body chooses to appear via teleconference or telephone, it is imperative that all other requirements of the OMA be fulfilled. A quorum must still be present, whether in person or on the phone, or in some combination thereof. In the event that a member appears telephonically is cut off, the public body should cease all discussions and deliberations until the member can be reconnected. We've never been there. I issued a request for my team this morning to begin to figure out how we can do that. We have members on the Board of Health who are in their 70s and 80s, who are at much higher risk. I don't know if they have chronic illnesses, but we know that people 80 years and older, the fatality rate so far that we've been able to record is between 14 and 15%. Let me change that so I put it into a number. That's 14 people out of 100 who die when they get the disease if they're 80 years and older. The measures we're taking now, the angst that we're going through is worth it because we're trying to save people's lives. Most of us don't save lives every day like EMTs do and like police officers do, but this is each one of our folks' opportunities and the citizens of Clark County to be heroes and to save people's lives. I know we don't have a case yet. I would ask you not to wait until we have cases, and I'm guaranteeing you that we will have cases. I don't know anything that you don't know other than I know how epidemics work and I know how the spread of this virus has gone. We're going to have the cases, and we're probably going to have some negative results from those cases. I'm urging you to get with your legal counsels and see how you can change your operations to potentially have meetings that work and that are legal, but are maybe not in person. Or if you have meetings that you have to do them in person, you try to spread people out. Luckily, we didn't have to drag anybody out of here who was hacking and coughing and sneezing today. Tim stayed home, so he's on the phone so that he wouldn't infect us because he's been traveling and he's got a cold. We all have to understand, those of us that have always powered through, oh, it's a mere scratch, it's a flesh wound, I can still go to work. We don't have to do that anymore. We're asking people to stay home. We have great computer systems now where you can log in and get your data and continue to work and be coughing at home rather than coughing at work. And sometimes some of our employees don't have that opportunity because the work they do does not lend itself to being at home, and we're just going to need to let them be at home when they're sick. Some of your employees are going to get quarantined. Sheriff, it's going to happen. We're going to have to figure out how we do business with a shortened staff. And I know I talked with the city police yesterday, and they're already multiple officers down, and they've got 18 more officers in training. But we're probably going to have to quarantine some of them along the way as well, because they're going to come in contact with folks and they're going to do their job, but then to not have it run through the whole ranks of our department, we're going to have to pull some people aside. The nice thing is, the more testing that's available, the least likely. So your quarantines, have they always lasted 14 days so far? Explain what happens.
Well, with
Wow.
so if someone gets tested, typically what we're seeing is it'll take 24 to 48 hours to get a result back. And say someone gets tested and they get a negative result, at that point, if they have been fever-free for 24 hours, they can go back to business as usual. So that quarantine, we say 14 days, be prepared for 14 days, but if you have a negative result, we're not going to keep you in your house for 14 days.
So we're not to this point yet, but let's just quickly talk. What happens if someone is positive for COVID-19? So after their fever goes away for 24 hours, they get to go back to work, right?
Nope.
What happens?
So if they're positive for COVID-19, that is when we need to encourage them to stay isolated in their home for 14 days from when they started experiencing symptoms. And when we say isolated in their home, for a confirmed case, that means staying in your room or in a specific area in your home away from other people in your household to try and prevent the other people in your household from getting sick as well. People in your household would also be affected. They would have to stay quarantined. So that means they have to stay within the home so that they aren't potentially exposing someone on the outside. So there's different levels of the, movement restrictions. isolation, which is the highest one where you stay and you limit your interactions with other people. And then quarantine is one step below where you would just kind of stay in your home and also limit your interactions. If you're positive, the contact investigation also falls to other people outside of your household who you've come into contact with. So that could be, your grandmother, who you go and visit every day, or it could be a friend who you have, had interactions with. It also affects your coworkers. It may affect your coworkers. Like Charlie was talking about earlier, we have a bunch of guidance that helps us walk through the different risk levels of your contacts, and each risk level would have a different type of restriction, whether that's quarantine, isolation, or just self-monitoring, or self-observation. Yeah.
So if someone tests positive and they're in the isolation for 14 days, do they have to take another test in order to be determined?
So
I think
I think the guidance on that is a little up in the air right now. They're advising us to take that on a case-by-case basis. The physician would definitely be involved just to make sure, someone might still be experiencing symptoms at that point, and for that person, they shouldn't, they should stay within their isolation. So that's more of a case-by-case basis.
So, but we need to definitely have the doctors do something somewhere. The medical people will decide.
It would be a conversation between the provider and the health department.
So some of the newest research that's coming out is telling us that someone may be shedding the virus for as long as 30 days. And so, if we tell you something today, I guarantee that by the end of the day, it will change. When we get those positive cases, we're going to have to, on a case-by-case basis, understand. So is it someone that was hospitalized and took 3 weeks to recover? Well, then it's probably going to be at least 14 days after they recover and get out of the hospital before we're going to put them back into a work or social situation. On the other hand, if it's somebody that's young and healthy and they have the cough and the fever, and they get tested, but they never get hospitalized, they never develop the pneumonia, that's going to be a different story. And so that's why it's really hard for us to give you a blanket statement on exactly what's going to happen. The other thing is, to be honest with you, we haven't had a case yet and gone through all that, so we're still learning. We're learning at an incredible pace. All of us are reading all the material. They're shoving so much material down to us that sometimes we're just passing it on, and we haven't even read all of it that we're passing on, because we don't want you not to have the information, but we also don't have time, because there's guidance on jails, there's guidance on daycares, there's guidance on nursing homes, there's guidance on hospitals, there's guidance on doctors' offices, there's guidance in schools and in workplaces. And I think, didn't we give them the workplace guidance, Emma, as part of the package?
The last page in your packet looks like this.
Okay, so we're just not able to keep up with all that information. So, Judge.
Are the quarantines being monitored? I know we don't have an issue here right now, but obviously it's coming. And if we do, who's doing that?
Okay, so the question was, are the quarantines being monitored? And if so, who's doing that? Right now, we're the ones in touch with those people who are in quarantine or are supposed to be in quarantine, and we're having a regular, it depends on the level of quarantine. So if it's a self-quarantine and self-monitoring, they go in and put the information into a database for us. If it's a certain level, then we contact them, whether it's a traveler that we're monitoring, etc. So it really depends on whether it's a mandatory or whether it's a voluntary. There's lots of different levels of it depending on what it is. The revised code actually lays out for the Board of Health to be able to mandate a quarantine or isolation, and also to hire, deputize and hire quarantine guards, which I don't think we've done in Ohio for over 50 years. So
I think Columbus is done. Is that right? Franklin County has.
honestly, I don't know what they're currently doing. I'm lucky to keep up with what's happening in Clark County alone. And we're trying to keep, but there's no good information. So much of what we can learn is really from a TV or newspaper website that you're reading. We're reading the same stuff, and then we're turning around trying to find a valid source that we can go to confirm. You know, the other day there were some new cases, and we're like, well, where are they and what's going on? So in some cases, we're in the same boat you are.
Is it help, so we're having discussions at the court because we're limiting the number of people coming in, and we've taken some precautionary measures, but we've had some discussion as to whether or not we should have sign-ins for people coming into the court, so that there, and I don't know if there's a bank at this, I mean, so to speak, of which, if you determine this person has it, so what are the points of contact this person can have?
Anytime that you can do something in your operations that will potentially help us with contact investigation, that is certainly going to be the case. So for instance, the gentleman in Canton that was the 4th case in Ohio, when they finally tested him and it was positive, they went back and he had 100 contacts that had to be investigated. That was one case. And so, you know, our team is pulling those out. We're looking and we're getting the contacts lined up. And so far, some of the people we've dealt with have been very forthcoming. I went here, I did this, and then other people are like, I don't have to tell you. Well, the law says they don't have to tell us until it becomes positive. And if it becomes positive, then we're going to have a little bit more serious discussion.
There was also, I saw this morning where they were, different people were depending on the type of business they had, but they were doing the temperature over their forehead kind of thing before they would let anybody in. And if it was over, if they were at 100 or above, they wouldn't let them in.
That's not a bad thing to do if you're able to do that for screening, to take a temperature. It depends on your operation. So one of the other things that we wanted to take a minute today to talk to you about is we need you to start thinking about your operations from the minute you started the day till the minute you end at the end of the day. And think about what are the touch points, what are the high traffic areas, what are the surfaces that people touch, what are the interactions that you're doing, and how can you do them differently. So for instance, we just got information, we run the WIC clinic in Springfield, which is the Women's, Infants and Children's Supplemental Nutrition Program. We know that's very important, especially for some of our at-risk and low-income families, to be able to get nutritious foods for their children so that we have healthy kids growing up with good nutrition. We can't just stop that program because the families count on that and the children count on that. But what we can do is our recertifications, when we're having an interaction with someone, and typically we take their height, their weight, and their hemoglobin, which means we're touching them and we're putting them on a scale and we're very close proximity, they've waived those requirements. USDA has waived those requirements in unprecedented, in 3 days from the request. They've granted that request and they've said we don't have to do that. So now I'm not having to put my employees at as much of a risk to be able to do their job. We're doing social distancing. We can still talk with the folks, but they've done a truncated nutrition counseling, so we don't spend as much time face-to-face with the client. Some of the clients were able to re-up their benefits without having them come in. The same thing is happening with Department of Job and Family Services. They're getting some waivers to be able to not see as many people as frequently over the next 30 to 90 days to see if we can slow the spread of the disease. So it's imperative that you think of those things and think of your entire operation. So for instance, we talked with the county and their staff, and we said, I know I'm spending the taxpayers' money. I'm a taxpayer, so it's my money. But buy a bunch of cheap pens, and when somebody has to sign something or write something, give them the pen and tell them to keep it. You know, send it with them so that, you know, in the doctor's office, they always have them chained down so that you can cough on your hand, sign in with the pen, and then pass it to the next person. Doesn't make any sense. We just gotta think through simple, basic stuff. So Dan's done something here that I was very impressed with. In some of their doors back here, to get into the office area, you had to reach the handle, touch the handle. So every employee, every visitor had to touch the handle and open it up. And so they took a doorstop and put in that door so that you can get it with your elbow or you can get it with your sleeve and not have to put your hand in that handle and share that. Simple things like that, that we can all look at our operations and say, how can we do this differently? If everybody comes and hits the automatic door button to get in, to make the automatic, even though they don't need the automatic door, we need to be visually having our staff, but we don't have a custodian during the day. So it's going to be our staff who goes out frequently and is wiping those high touch surfaces down. Commissioner?
Question about, I guess this is gonna help related, I don't need an answer right now, but this is probably an area for guidance. Somebody contacted me from the community blood center saying that they were getting very low on donations. So are there recommendations about giving blood? Will blood be able to be tested for coronavirus? Is that even a method of transmission? But you know,
So
that's one of those kind of vulnerable
Right, so the
areas.
question is about the blood bank and donations. I can tell you that our expectation is that the number of donors is going to decrease because many of the donors are retired. They're folks who remember it back from the war, and they've always done it, and they've been great at giving blood. We think it's an opportunity for our younger people who are not in school right now to help out with that, and we encourage them to consider that. How they're testing and what that's being done in, I'm sorry, we don't have that information, but we do know that the blood supply is expected to go down, and we're not going to ask our senior citizens to go and give that blood because that's not a good situation for us to put them in. Mr. Mayor?
I already gave my blood last week.
Well, they want more.
I've had a conversation with the city manager and the law director. I may need to declare an emergency. That doesn't mean anything has changed, except that we have problems. You mentioned our police department, et cetera. Under our charter, that only if we declare an emergency and we deal with some staffing issues that they have, et cetera. So,
Right. So I'm
if you
glad
hear that I've declared an emergency, it probably doesn't mean anything is different than it was. It's just what we have to do our jobs.
I'm glad you brought that up because that's something that is on our talking points for you today. We are going to be talking to Clark County and having the EMA is already preparing that resolution. We would like to talk with the city of Springfield and we'd like to talk with the city of New Carlisle to have you consider declaring an emergency. And it's not because we have a case in Clark County, right? It's because we know we're going to have cases in Clark County. It opens up some funding for us because there might be a little bit of the $50 million that was released when the president declared an emergency yesterday under the Stafford Act that we could get back into our county. It's not going to pay for all the stuff we're doing, not by a long shot, but it might help us offset some of the monies. And it also opens up, as the mayor said, it opens up some other opportunities for us to deal with staffing in the two cities and within the county. Now, you would have to talk with your legal counsels because we haven't done this before for a public health emergency, but I would think that the county declaration may help all the townships that you wouldn't have to make your own. But I think I'd ask a quick question to the legal counsel. Is there a reason for the townships and villages to declare their own emergencies? But the mayor is very right. We need to couch this in, we're doing this to prepare for the advent of cases, not because we're trying to get the people to panic. When the declarations come though, people tend to want to panic. Well, the mayor must know something I don't know, and that's why he's doing that. That is not the case. Folks, we have a way that we're going to tell you. So when we have our first case, the idea is we're going to form a press release with the Ohio Department of Health actually, it's already formed. It's ready to go. And we will contact the chief executive of the jurisdiction in which it happened. We will contact the fire chief because of EMS, and we will contact the police chief. And we will ask the chief executive and those folks to reach out to the other members of the councils or boards in those jurisdictions so that you're aware of it. I apologize now for the fact that some of you are going to first hear it on the media after the press release before we're able to contact you directly. We will contact the chief executive, the fire chief, and the police chief or law enforcement agent who's in charge in that jurisdiction. Because that will happen very quickly, we're not able to take the opportunity to talk with every elected official about those circumstances. So I apologize, but I know that's going to happen rapidly when it does occur. And we're not going to let you know ahead of time that we're testing people. That's one of the things that's not supposed to be happening across the state. You shouldn't know how many people are persons under investigation in Clark County at this time. We're not disclosing that information. We will disclose the information when we have a positive case, because the public's going to know pretty rapidly, because we're going to be reaching out to those 50 or 100 contacts, and it's not going to take a rocket scientist to figure out who these people are. We are going to make sure that we're not going to give out their identity, and we're going to make sure that they're treated appropriately. In too many cases, we're having people say bad things about them. You know, everybody can say nasty stuff online because they can hide behind their computer screen, but there's really been a stigma related to those individuals who have COVID-19, and I can tell you, they've not gone and done anything wrong. They were just in the wrong place at the wrong time and were exposed to the disease. So as public officials, the more of that message that we can get out, once it does occur, especially if it occurs in your jurisdiction, we need to tamp some of that down, because honestly, it could be any one of us that gets this virus, and or it could be any of our citizens, and they deserve a modicum of respect, because we need to understand what they're going through. We also need to understand that at some point we're going to be reporting a death from this. Don't know when. Don't know if it's going to be in a week or 6 months, but we are going to be reporting that, and that's going to be a tragedy for those families that are involved. Did you have a question, Rob? I'll get to you in a second. Sheriff? Okay. Sheriff?
Yeah, Rob did.
Oh, no, he declined. He gave his time to you.
We need to stay, the sheriff's office needs to stay as close in touch with you as we can. Not only do I have officers on the streets, I have officers that work in the jail, plus I have inmates in that jail. Due to the fact that the jail is always full, we have very limited space to isolate any inmates. All right. And then if I get my deputies that are working in the jail is not in there working, we may turn into a crisis. We don't want to scare anybody, but we need to work as close as we can with you and the health department to make sure that we're doing everything we can to keep the jail and my road officers, keep protecting the citizens of Clark County, because that's what we want to do.
Absolutely, and we have additional measures, equipment and hand sanitizer and stuff that we're trying to procure for all of our first responders, because this very quickly, if we don't keep the curve down, even if we start to see the upswing in the curve, our first responders and our hospital personnel are going to be people that are going to be greatly affected by this, and so we're going to have to figure out what a different world looks like when we have to set some people aside. That's why I'm excited that there's more testing coming online, because in Singapore, when they were able to test and do when they were able to test and quickly identify the contacts, they were able to very, very quickly slow the spread of the disease because of that, because of those contact investigations and testing. It also allows us to get people out of quarantine more quickly when we can do more testing. So that's going to be helpful as well. So we'd love to have additional meetings offline with the sheriff's department and the jail staff, because you think a cruise ship is bad. I'm really worried about nursing homes, hospitals, and prisons and jails, because literally, we have a captive audience, and that's one where it could spread very rapidly. We're also looking at some extended work that we need to do with the city and with the homeless population because they're at a much greater risk for this as well. So we have folks online. Do we have any questions online?
You've all been unmuted. Does anybody that's online have a question?
I have a question.
Go ahead, Dr. Thompson. Dr. Thompson is the medical director at the Combined Health District.
Can you hear me okay?
Yes, ma'am. Loud and clear.
I was wondering if the point of contact criteria is available for those at an office or place of business. I'm just planning ahead, thinking if we see cases that come into our office, my staff, is it better to me have half of them in the office at a time and stagger their shifts, so to speak, so that we're not all going to be under some sort of quarantine or under investigation? So that was one question. Another point that I was just going to make, the respiratory testing that you asked about, the cost is somewhere around $700 to $800. You had mentioned something about the respiratory panel cost for patients and offices, and that's what that is, at least per our records. So is there something I can find in regards to, is it just if you're within 3 to 6 feet, if you were in the same office building, for those patients that potentially could become positive, and what we do about our contacts for staff to minimize that exposure?
Hi, Dr. Thompson. This is Anna Jean. There is a lot of guidance on the CDC's website right now, so specific guidance about people who may be positive for COVID-19 and their contacts. And then there's also specific guidance for healthcare personnel who may have been exposed to COVID-19. So I can email those links to you later today.
Thank you.
For those of you that want to see what that criteria is, not the medical personnel criteria, but if you go on to the CDC website under coronavirus tab, and then you look for, you put the words risk assessment in, that risk assessment is the actual document that we're using on a daily basis to look at the potential content for that. So go ahead.
And the document also has the definitions for quarantine, isolation, self-monitoring, self-observation, active monitoring. So if you're it also defines close contact, what that might mean. So if you're interested, that's all in there as well.
Right. So it's not just 6 feet. It's not just were you in the same building, but how long were you with the person? How close were you with them? Did you go out to eat with them? There's lots of things. Or are you living with them? So a normal household, so that they're using words like a regular household contact. So someone who would be in your kitchen and in the bathrooms and stuff with you as well.
If I could trouble you, a couple of questions. And a couple of questions, thank you. I've heard different figures in terms of the mortality rate. And I'll talk to one person, he says this, another person says this. And I'm looking at the report on CNN this morning, and they're saying there are 2,200 active cases in America right now, and that there have been 49 deaths. So that is like a 0.02% mortality rate, but then I'm hearing 3 to 5%. First question is, how do we get what figure? What's accurate? The second question I'm wondering is, the universities right now, for instance, are saying we're going to go online and close the campus until April 13th. Where does that date come from? How are we getting 3 to 4 weeks rather than 3 to 4 months or 3 to 4 days?
So let's take your first question first. The initial mortality rates came out of the outbreak in China, and so they're looking at that, and then they were initially looking at the cases in the United States when we had the deaths in Washington State in the nursing home facility. So what are the real death rates? Honestly, we don't know. We can only use the historical data that we have that's in a peer-reviewed journal like the Journal of American Medicine to move forward. Now, do we hope that those rates are better when we come in the United States? Do we hope that if we push the curve down and we have good medical care for all those people, that it's going to be much lower? Yeah, it's very possible. But until we live through this, we're not. We don't know. We don't know what those statistics are going to be. I mean, it's a great question. I've heard the same things you've heard. You know, one doctor was, well, we're extrapolating that if 80% of the people don't get an illness that's to be hospitalized, so that there are this many more thousands of cases that we don't know about, and therefore that pushes the number down to this level. The other thing is, just because there's a case, typically we don't see them seek hospitalization. Are we still at the 9 to 12 day? So 9 to 12 days after they get sick, we see them seeking medical care and be hospitalized, especially for the pneumonia conditions. So that number of 22 went up by how many hundred in the last day or two. We may need to wait a week or two to see how those people are going to do. Many of them are going to recover, and many of them are going to get worse before they either get better or have a negative result. So your second question again?
Where did they come up with the
Okay,
reopen the universities?
Right. So for instance, the governor's closed schools for 3 weeks. That's a placeholder because we really don't know what's going to happen with this pandemic curve in Ohio. So right now they're saying it's 3 weeks or it's till the end of the month. A lot of stuff I've heard is, well, you know, Clark State's closing the Hollenbeck Bailey until the end of the month. Once again, I think it's just a placeholder because we don't know what the next couple of weeks look like. The governor is very clear. The schools are closed for 3 weeks and that will be reevaluated. It's also giving the schools time to figure out, okay, so if we had to go do some online learning, who could do that? What grades would that be possible? So just because the schools are closed doesn't mean that the administrations are sitting at home. You know, they're all working towards what's going to happen in the future. The predictions from the state health department, and jump in here because I've missed some of these calls.
So I believe that the issue is that they expected that the disease here will peak somewhere between end of April, mid-May, it's just modeling.
Our, Ohio or US?
That was
Ohio number.
Ohio, and so that's why a lot of these are 45 days or so out. That's what they're thinking. Of course, all that could change depending on how that curve lengthens when we squish it down. You know, so it changes. And I've heard a lot of caveats lately that we're going to do this for 5 weeks or 3 weeks, and then we're going to reevaluate. And I think the schools have been plainly told that this is for till what is it, early April, I believe, but we're going to reevaluate. It may not just be the 3 weeks. So everything that is happening is, this is what we know at this time.
So it really is a placeholder, Judge. It's a placeholder because we don't know what the future holds. And if, you know, if my prayers are answered, then you'll all eventually come back and say, well, that guy lied to us because nobody got sick and nobody died. And that was a bunch of crap that we went through. We went through all this heartache and my stocks went to hell, and all the government officials that talked to us, including Charlie Patterson, lied to us. How many people don't get food poisoning because our inspectors are out 5 days a week inspecting restaurants? I don't have that number. I really don't think that that's going to be the outcome. I really, unfortunately, think that we're going to see sickness and we're going to see disease spread across our county, and we're going to have to deal with it.
The reason, part of the reason is that a number of courts across Ohio are bumping their jury trials back 30 days. And, you know, I don't know how optimistic they should be that it's actually going to go forward at that time, or whether it's just, everything's just going to keep getting knocked back, or whether we're going to change how we approach the disease.
Right. So, I mean, I know Come and Please is looking to do that here. Municipal court can't really do that because they've got a mandate to do something sooner. Either we have to change the mandate or we have to figure a way out, how can we do this and keep people safer? So in that 30-day period, we're basically using it once again as a placeholder, but we're using it as a time to change what we do. How are we going to do this in 30 days and keep the jurors safe and keep the judge and the bailiff and the court reporter and the defendants and the attorneys, well, maybe not the attorneys. But that was just a joke. That was a joke now. Come on. Come on. I think this is an ultra serious situation, and I'm sorry sometimes I use humor in trying to deal with it because I've not seen a public health situation as intense as this is going to get in my 30 years. So it really is a serious situation, but I think we have to use a little humor every once in a while. So I'll get back to you.
So I need to ask, and I don't mean any joke by this at all, of course not, because I'm in the funeral business and we have this situation. I know there's exemptions, but as this continues to get serious, are you recommending that we kind of make firm suggestions to the family to do what they can? I mean, I've got a situation this week, many of you will know that Commissioner Scobie's wife has died, and this will be a large gathering that he's planning this week. Not at our business, but at a local church. But these are things that we're going to face like right now, and then also small businesses like myself who have to go into nursing homes and other things. Should I recommend my staff? I mean, we're not walking in with masks yet, but I mean, the more official it can be from the top, the easier it is for us, just like what the governor and the president's done.
Right. So there are recommendations for limiting the gatherings, and I saw some stuff. We'll have to research it. We'll try to get it out to the funeral directors about recommendations for funerals and truncating the funerals and that sort of thing.
I mean, I've got some Ohio funeral. I already have some of that information. But
So we'll see if there's anything different, Christina.
Right, so I think what has been out for a while is, of course, how to deal with postmortem bodies, but what I have not seen, and maybe
Okay.
it's back out, is
It's
more like the funeral.
Yeah,
So
there is something about funerals and the recommendations for shortening them or eliminating them and how to deal with the families in that time.
Charlie, if I just could, I think one thing that might just help to preference this is like so off of your 100,000, you mentioned that 100,000 persons, and Charlie hasn't had the advantage of sitting on all the conference calls. So, and one of the things that I sat on yesterday, so Dr. Acton, the Ohio Department of Health director, used the phrase 100,000 cases as that is what the modeling tells us is probably circulating now.
Okay.
They're just not identified. So I want to be very clear. The expectation is that 40 to 70% of the population will be infected at some point. That's based on modeling. So I just wanted to give you that frame. Now, another point of framework is that you are going to, so if there's a positive case, we're going to do a contact investigation from the day of their symptoms 14 days back. How many of you know where you've been 14 days? Because right now, we're not entirely sure at what point the person starts shedding the virus. You could shed it way before symptoms. So 14 days back. So when you're planning your operations, whether it be funerals, whether it be anything, take that assumption you have no idea what's in that room. And then make your best common sense on that. Because there's just too much unknown. And the CDC, so many times, you go and you find a little disclaimer, this is what we think we know, or this is still being investigated, but this is what we think. So if you use those two preferences of I don't know what's in the room and who's in the room and who's already infected, because even the kids, for a while we thought kids weren't getting it. Now they're saying kids are getting it, they're carrying it, they just don't get that sick with it. So they can carry it, potentially transmit it. So thinking through those things too, I think might help, because we can't have, and probably CDC is not going to address every single situation, But then using those bases, you can kind of make your decision.
So before we move forward, I just want to circle around to something that Dr. Thompson said about thinking about how we can potentially split our staffs or limit their contact. So for instance, I'm going to use the county utilities department as an example. They have 8 people who they're certified, EPA certified water and wastewater specialist certificates that they have to provide safe, clean drinking water in the county and properly handle the wastewater. Every day, they used to come around the table, all 8 of them, every morning and then every afternoon at the end of the day, and they've stopped that practice because he said, I can't have you quarantine all 8 of my people, even though I threatened to quarantine them at the wastewater and water sites. He said, I can't have you quarantine my whole 8 because they're together for an hour a day, the 8 of them. And so we're splitting them up. We're gonna do, talk to somebody else who's gonna do shift work. The city of New Carlisle is looking at bringing their people on in an A shift and a B shift so that maybe they don't all come together every day and you lose everybody who works in the New Carlisle offices. So that's stuff that we have to think about, something new, something different. I hearken back to when I was a kid, there was an energy crisis and I went to Rockaway School, but I didn't go to Rockaway School for a month or 2 because they took us out to Shawnee High School and we had class out there for half a day. And then they brought another cohort in because they weren't going to heat Reed, Rockaway, and Possum. They only heated the Shawnee building to save energy. We've got to use that as a model and think about how we can do our operations. Judge, you were first.
I just really want to point something out that you gave as advice at one of the meetings, multiple meetings we have at a time. And that has really helped guide our discussion at the court. And you should ask yourself 2 questions. Is what you're doing essential? And that has been extraordinarily helpful. And if it is, can you be maintaining safe contact or safe distance? And that, in terms of like just our operation, having our conversations, that has really helped frame how we come up with our practices. So I'm just thinking of that. That's Charlie's. That's not. He suggested that to us, and that's been extremely helpful.
That's great. So I'm just going to repeat that to make sure everybody on the phone can hear. When you do have to have a meeting or when you do have to have a gathering, we are recommending, and this isn't Charlie Patterson, okay? This is the governor of the state of Ohio. Is it necessary? Well, for our public meetings for the Sunshine Act, depending on what your attorney says, with the letter that the AG's office came out, is it necessary to meet? Yes, it's necessary to meet. Can you maintain social distancing? Well, you may be able to do that now by video conferencing. You may be able to have your meeting on a conference call. It's always nice to have the people's, because I know very quickly when my staff is rolling their eyes and I'm saying something that maybe I'm off track, or maybe I need to rethink that, but we're going to give up some of that to make sure that we keep people safe. So is it necessary? And if it is necessary, how can we maintain social distancing? We're having a district advisory council meeting Thursday. We just got the AG's opinion, and so we haven't extrapolated that out to see how we can handle that. Is it necessary? Yes. We have a vacant Board of Health seat. Kind of right now with what's going on, I'd really like to have that seat filled so that we have quorum and we can vote and do all the stuff we need to do, because the Board of Health is going to be more and more involved, I suspect, over the next coming months. So it is necessary. So then how do we maintain social distancing? Well, we're trying to make sure we space people out. We're going to have a short meeting. We're going to tell people that they can take their meals to go. They won't have to sit there all around the table and share. So if we can figure out a different way to do it between now and Thursday, our IT guy, we asked him early this morning to start working on that. We'll figure that out. But if not, I think the video, it's interesting. In the letter, he says video or conference call, but I think the video is probably important with your attorneys to make sure that we know who is talking and who's on the phone. That's probably something that they're going to stick to. Over here.
Well, I had a couple questions. One of them is there any additional updates on how long the droplets, how long on surfaces that is lasting?
I haven't seen, have we seen an additional update?
It changes a lot. Right now, the last thing I saw was 24 hours on paper or cardboard, up to 3 days on plastic or stainless steel.
So it depends on whether it's a hard surface or porous. The initial information we got was it could be as many as 9 days. And I guess you're telling me the latest is like 3 days?
Yeah, that's the latest. But again,
So it doesn't matter what it is, wipe it down.
yeah.
Make sure that when we're wiping it down, we're using an EPA certified cleaner and that we're using it to the correct contact time. So some of our cleaning folks have found a 1 minute contact time, which is great because it means you spray it on. Before you wipe it off and dry it, it needs to be in place for a minute. Some of the cleaners are 5 minutes or 10 minutes. It depends on what that is. Read the label. Anything that will kill bacteria and germs will kill this, is what they're saying. Any EPA certified cleaner. Alcohol at 60% or higher will kill it as well. So rubbing alcohol, you just want to make sure that you don't drink it. If you are going to use drinkable alcohol, you really need to use 120 proof or above. 120 proof is 60% alcohol by volume. So you just take the proof, cut it in half, and that gives you your number. So I think we've decided that 151 is now back in, and that's going to be strong enough to kill.
My second
Mr. Patterson,
Go ahead.
I have a question. This is Tony Keller, and I was wondering about large crowds outside in an area.
So the restrictions are that large crowds indoors or outdoors, including parades and other events, are currently banned. Well, if it's 100 or more people, but we're going to take it a step further and say, is it necessary? And if you are having it, can you maintain? So I don't want to get hung up on the 100 number. The 100 number is the number that legally I can come in and enforce and say.
Okay, about like we have an auction, Ritchie Brother auction. They're going to do it online because I asked them to do the online rather than there on site. But they're still allowing the people to come and look outside at all the equipment. I was wondering about that.
And I think that in that case, they're not going to be bunched up all at one time. They're going to be walking around the huge yard there, looking at the equipment. We would just not want them coming to a central place all at once. So
okay.
It sounds, we've been trying to talk with them as well, our safety and health person, to make sure that we can have good distancing and still have that. So honestly, folks, we're not trying to kill commerce. That's not what this is about. We just need to have the commerce happen in such a way, like Ritchie Brothers, many of their people bid online anyway. And so we're still trying to see how they can bid online, but still have the ability to inspect that equipment. So great point, Tony. Thank you.
Welcome. Thank you.
My second question is, have you had any communication with Centers for Medicaid, Medicare in regards to lightening any of the requirements? So, you know, a lot of the individuals we serve, I have to have people in their homes providing care and support because of their disability. But, you know, to do meetings and writing up service plans, there's a lot of requirements there. We've not had any response on, is that being waived?
One of my day job is I work at the Social Security office here in Springfield. The subcategory off of that is I do national health and safety for all Social Security offices themselves. So what we're doing is we're trying to be proactive. It's changing minute by minute. One part of that is we're trying to get signage when you come in the offices to say, if you've had this similar to what the hospitals are gauging. The second part of that is that we're trying to reach out to the people we deal with, which a lot of us have the same people in common, particularly here in Springfield city area, to say, don't come in the office, we'll call you if there's an appointment, try to stay out of here. My big thing is while the federal government is always slow to act, we're trying to be very proactive as far as providing protective items for our people, via mask, the gloves, the wipes, the hand sanitizers. So we can't control who comes in through our doors naturally like everybody else in here. But what we have to do is try to be reactive to the people that we're serving to try to curb it or keep them as protected as possible. So I anticipate that we may stop dealing with public walk-ins before it's all over. And saying, you know, we handle the Medicare, not Medicaid, the Medicare part of that. So we did see yesterday the state determination disability service closed down. So a lot of these state federal agencies are looking at how we're providing services. I anticipate that to be changed at the beginning of the week to follow these guidelines more.
Did you have anything else to add to that?
No, I guess I would have expected that you would have heard from CMS because what we're hearing is that these changes are being made.
I
So
understand
I'm
that.
concerned.
I am concerned.
Okay, so maybe we need
So
to
right now,
follow up
I'm
on
not
that.
following the CMS guidelines, to be quite honest, because I'm restricting and holding service plan meetings because it brings people together and
Right.
some of the most vulnerable population. And I'm
I
like,
just
I
think
can't do
we
that.
need
So
to
we'll-
understand that better.
We'll follow up with you on that because there, a lot of those types of requirements are being waived, like our, you know, the WIC requirements, the U.S. Department of Agriculture has waived lots of requirements for like the city schools and where they provide food. Since the kids aren't coming together, they wouldn't have been allowed, but they're gonna go ahead and continue to have lunches. So the kids, but they're not having community lunches. They're saying, come in, pick up the food and take it with you. So we're still able to provide food in those requirements. So one of the things that we've heard a little bit of discussion about is masks. It is still not a recommendation for healthy people to wear a mask. It is a recommendation that we have something to put on sick people, because remember we talked about that, how it's spread, that cough, that sneeze, where that respiratory droplet goes out. If we put a mask, we're not going to 100% prevent that, but we're going to keep a lot of that from being expelled straight out to the person that they're around. And so we put a mask when people come into the emergency room or they go into their doctor's office. We put a mask on them. The other reason, there's a couple reasons why healthy people shouldn't use them. Number one, healthy people don't wear masks a lot of times, and so they don't know how to wear the mask properly, and they will adjust it a lot, and they'll touch their face a lot, so they actually increase the chances of touching your face. They also, think about what happens with a mask. It's right here. So your warm, moist breath is creating a perfect environment for other things like bacteria to grow right up around your mouth. But the most important reason why healthy people shouldn't use masks is because then we don't have enough masks for the sick people and for the medical providers who need to protect themselves when they're doing procedures or they're in rooms with very sick people. So if the general public, you know, it's kind of like giving blood. What does giving blood do for you? Well, not a lot, but you're doing a great thing for everybody else. By not wearing masks, healthy people can leave those masks for the sick people and medical providers and EMS workers that need them. So all of you as elected officials, you all have spheres of influence that are greater than the typical individual. We need you to be using those spheres of influence to stop the panic, to tell people what you've learned today and what you've learned from reputable sources like the CDC, and to be able to ensure that things are working, things are happening. There isn't a bunch of information that we're hiding from you, or, you know, we don't have a bunch of cases that we know about, but we're not telling you. That's just not the case. It's not a conspiracy. It's what we all have to do to pull together. I have gone 20 minutes over the 1 hour, and so I think we need to wrap it up.
Sam Stokey, Village Commission, South Charleston. How are we supposed to have people not panic? We've got the governor of Ohio on national television last night saying that he believes there's 100,000 cases of this in Ohio already, and it will double every 6 days. How are we supposed to keep people from panicking when the governor's saying that on national television?
So, I mean, that's a good question. I think we need to educate them. We need to educate them on why we're doing the stuff we're doing to slow the spread of the disease, to make sure that we can properly treat those individuals who rise to the level of needing treatment. And we need to do it in such a way that that they're looking at reputable sources, not conspiracy theories and all the other
You
stuff.
can't get more reputable than our governor.
Right.
And if he's saying these things, how am I supposed to say, well, we're doing everything we can? Well, the governor said, we've got this many already, and it's going to double every 6 days. Why would they listen to me?
I think that you can say, well, the governor has experts and he's probably right. And so that's why we have to follow all the recommendations. We don't need to panic. We need to follow the recommendations.
You hear those numbers.
We need to think
10
about.
weeks, there's going to be 1 million people. You hear those numbers, people are going to panic.
That's why we need to tell people about staying home when you're sick and washing your hands and doing the things that they can do. And this is almost, we're to the point where we're telling people, you know, you got to do your patriotic duty. Your patriotic duty is, in some cases, to stay home and to wash your hands and to figure out how you're going to FaceTime with grandma. Even though grandma doesn't have an iPad, maybe it's time to buy an iPad for grandma and FaceTime with her rather than taking the kids to go see her. I feel bad for grandma. I feel bad for my own father. He loves to have people around because he doesn't talk to anybody the whole rest of the day. He's in his house by himself. And now I'm telling him, don't go to Meyer and talk to the greeter there, who you're friends with, because it's not a good idea. I'm not trying to kill him. I'm not trying to kill him with his mental health. So I got to figure out how am I going to talk to him more frequently on the phone, and how am I going to do that? And so we all can do that. We can all spend some of our time reaching out to our elderly in the community and having those conversations. It may just not be in person. But I think as elected officials, we have the ability to not panic, but to say, okay, well, you know, the governor was serious. The governor was serious about all that stuff. The governor was serious that we've canceled trips for spring break, and we're not going to use the next 2 or 3 weeks or more that the kids are off of school to travel around the country and bring more disease back to Ohio. We need to hunker down a little bit here, and we need to use common sense. Common sense is not prevailing in the grocery stores right now, but I think that will level off, and you know, in a week or two, the stores will be restocked, and there's going to be food enough for everybody. We still have a good supply chain. That's why we're trying to keep it. That's why we're asking everybody to do their part.
That CDC website, though, I think is excellent as far as for references off of that, because almost any scenario you can come up with, it's got a click box there. You can get into the state site. Seems like it's better on numbers as far as what's happening. But the CDC,
we go directly to the CDC website because everything at the state level is basically coming through.
All my employees, all through the state and through the country, just so they can hit that link and come up with a quick answer.
Is that just one question?
Yes, the link. So that is a link to specifically the employer guidance, but you'll get to the section. The actual link is just cdc.com/coronavirus, right?
cdc.gov.
.gov, sorry.
Yeah, and it also has information, like there are pages for what to do if you're sick, how to prevent the spread of coronavirus in my home, like things like that, about preparedness.
Everything.
So there's stuff for, you know, local health departments and healthcare providers. There's also a lot of good resources for the public.
Is there a paper that we can print off to like put at the end of our, because we have four cash registers.
There's some
And
great.
usually we set things there for information, so when people are coming out, is there things that we can grab to prevent the panic?
Yeah, so ODH has really good printouts right now around hand washing and prevention stuff. Also, I was just gonna plug, follow us on Facebook. We're sharing a lot of things that are usually images that if you wanted to take and print, you could easily. Also on our website, obviously, www.cccht.com. And then the Ohio site, which is coronavirus.ohio.gov, really easy to navigate for everyone. And then of course the CDC.
So if There are great infographics, like one-page infographics that are easy to print, very colorful. If you have color printing, that are super just to put out for people to take or to have on your counter. Those are great resources. Greta, do you want to wrap us up with
Thank you. One quick question. If a person does not have a primary care doc, what do you recommend? And they think they may be tested or have symptoms. What do you think?
So the message that I've been giving to people when I get that type of situation is, first, are you sick enough? Forget that this COVID-19 is happening. Are you sick enough to see a doctor? Under normal circumstances, would you try and seek medical evaluation? And if the answer is no, then our advice would be to stay home and try and get well. And then, of course, if they get worse, then that's when they would have to call the doctor. If the answer is yes, that they would see a doctor, urgent cares and hospital. I'm not sure.
Yeah. I mean, this is the reality that we live in, and there's not good answers. But if it is serious enough that they need to seek medical care, then that's got to do what you have to do.
The question would be, where would you, if you don't have a primary care physician and you were needed to seek medical care, where would you seek it? Then you should seek it there, but you should call first.
Call first, even if it's urgent care or hospital.
Right,
Yes,
even if it's urgent care or
definitely.
hospital, you should always call your provider with the symptoms of COVID-19 before you go in, because most of them are going to refer you someplace other than their office because they don't want to get their office staff sick.
Or
and
they're
all
just
the
not
medical
prepared.
providers.
They just don't have the proper personal protective equipment, to put on so that they can protect themselves. It might not be that they don't want you there. It's just that they want to make sure that everybody is safe, including, the patient and the providers.
Excuse me.
Yes, go ahead.
Can I ask a question? This is Amy Hopkins. And you were quoting some websites to go to. One of them was yours, and it was said so fast I didn't catch it. Could you give me the site again? Or is it on the documentation you sent out?
It's cccHD.com, and we will send a follow-up email. We'll put a bunch of links. So if you were on the invite or you send it to another person, I'll send out a bunch of links before that to other people. We'll put all the necessary links on that.
Great.
The best link for you is cdc.gov. So cdc.gov. When you go onto that site,
C is in C, and then D is in David.
Charlie, Delta, Charlie.
It's in Centers for Disease Control.
Okay, got it. And then
once you get to that site, at the top of the page, you'll see the place to click. It'll be a big banner right across